Have you been following a generic set of stretches to treat lower back pain and feel like nothing has improved or that the pain got even worse? Let's fix it. My name is Solomon. I got my degree in the study of human movement, and I will go over the common causes of lower back pain and an exercise routine to fix it while addressing what type of pain each exercise is ideal for. Let's go. Lower back pain and discomfort are a very common issue that can vary from mild discomfort to severe pain that limits movement. The lumbar region of your spine supports a significant portion of your body weight, making it susceptible to increased stress and strain. However, not all lower back pain has the same root cause. The area's complex structures of vertebrae, muscles, ligaments, and nerves can lead to a similar sensation of pain, but will require a different approach to fix it. The common causes are muscle weakness or overuse, poor posture, sudden movements, arthritis, and bulging disc. Understanding which one is the cause of lower back pain is the key to treating it and preventing it from reoccurring down the line. The good news is that in most cases, lower back pain and stiffness can be managed with the right approach. The exercise program will cover gentle stretches and specific exercises to relieve pain, improve flexibility, and increase the strength of the supporting muscles. I will also address what type of pain each exercise is for and when to avoid it. Let's get started. The first movement is arms overhead. Stand with the back straight and feet shoulder width apart. Gently raise your arms overhead while breathing in deeply. Hold for 10 seconds, then reach higher and further back, feeling a stretch along the sides and your lower back. Hold that position for another 10 seconds. That's 1 rep. Keep going for 3 reps. This stretches the muscles along the side of your body, including the lower back, while relieving built-up tension and pressure caused by muscle tightness and poor posture. Avoid this movement if you have a herniated disc, especially in the upper part of your lower back, because reaching overhead might aggravate it. The second movement is a Psoas stretch. Take a step forward as if you're getting into a lunge. Raise your opposite arm overhead, lean towards the side of your leading leg, and drop your shoulders back. Hold for 3 to 5 seconds, then take a step forward with your other leg, switching sides. Each hold is 1 rep. Keep going for 6 reps per side. This stretch targets the psoas muscle, which often becomes tight and causes lower back pain, especially in those who sit for extended periods. Now, if your spinal nerve is pinched, like spinal stenosis, this stretch might not be for you, because leaning forward can increase pressure on those nerves. The third movement is a cat-cow pose. Start on your hands and knees with your wrists directly under your shoulders and your knees under your hips. Inhale as you slowly arc your back, lifting your head and tailbone towards the ceiling. Then exhale as you round your back slowly, flexing your spine as well as the ball and socket joints of your hip and shoulders, while tucking your chin inwards towards your chest and drawing your belly button in. Continue to flow between those two positions for 7 to 8 reps while avoiding overstretching at the end of each motion, as the goal here is spinal movement. This increases fluidity of the spine by reducing spinal stress, stiffness, and friction. If you have brittle bones or a recent spinal fracture thus causing lower back pain, then skip this stretch, because the bending motion might put too much stress on your spine. The fourth movement is hip hikes. Stand next to a wall, placing 1 hand on it for support. Stand on 1 leg and lift the inner leg off the ground. Drop your unsupported hip towards the floor and then drive it back up, focusing on the contraction of the glutes. Hold that contracted position for a few seconds. That's 1 rep. Keep going for 3 sets of 10 reps. This strengthens the muscle that stabilizes the hip, especially the glute medius, which can treat muscle imbalances, helping relieve lower back pain. Now, if the cause of your lower back pain is hip arthritis, avoid this movement because the lifting motion in this exercise might cause more pain. The fifth movement is hip airplanes. Brace your core and stand on 1 leg in a slightly bent position. Keep your arms out to the side for balance and lean forward at the hips, keeping your back straight. While extending your other leg behind you, slowly rotate your hips inwardly towards your planted leg and hold for a few seconds, then rotate it outwardly and hold for another few seconds. Both rotations on 1 rep. Keep going for 3 sets of 3 reps. This improves hip stability and strengthens the muscles around your lower back to relieve pain. However, if you have a condition in the sacroiliac joint, which is where your spine meets your pelvis, then avoid this balancing exercise because the twisting motion can increase its pain. The sixth movement is side-lying hip abduction. Lie on your side with your legs stacked. Place your thumb on a Psoas, which is the bony prominence at the back of your hip. Apply pressure from your hand and move your leg down slowly until your knee touches the ground. Then extend your leg back past the midline of the body and hold for a few seconds. Then lift it back up and hold for another few seconds. This cycle is 1 rep. Keep your hips steady and go for 2 sets of 10 reps. This strengthens the gluteus medius, which helps maintain a level hip while supporting the pelvis and lower back, reducing lower back pain that's caused by hip weakness and instability. Avoid this movement if you're dealing with hip bursitis, where the cushioning sacs around your hip joints are inflamed. Try to do the exercises 4 to 5 times a week, and you will notice relief instantly, and it will keep improving over a few weeks. In the initial stage, you may notice some mild soreness in the muscles you're targeting, which is a natural response as your muscles start to adapt and begin to strengthen. You then notice an increase in flexibility and a reduction in pain and stiffness after each session. That's why recovery is a gradual journey and why it's so important to listen to your body and avoid pushing through movements that cause sharp pain to achieve long-lasting relief. To sum things up, treating and preventing lower back pain and stiffness is achievable. First, follow the correct form for each exercise and avoid overexertion in any movement that makes the pain worse. Second, stay consistent with the stretches and exercises that target your specific type of lower back pain to relieve the pain and stiffness while improving strength and flexibility. Third, pay attention to your posture by not staying in any one position for too long, which can increase the stress and tension on your lower back. And that's it. Keep it simple and precise to achieve long-term results. So as always, stay active and mindful.